But then what we see in clinical practice and what the registries are starting to show is that when you start to actually treat the pain generators, you treat that infrapatellar branch saphenous, you treat that MCL, you treat that fat pad, and you treat the joint, that's where you're going to get much better clinical improvements. But so here, this I think is going to be the crux of the orthobiologic space and what will make or break its adoption into allopathic mainstream medicine is an understanding that you have to treat the pain generators.
Yeah.
Because again, you guys know this, but if somebody comes in and they have, let's say, grade 3 knee osteoarthritis, but most of their pain is coming from the MCL, infrapatellar branch of saphenous, and Hoffa's fat pad, so they get that anterior medial knee pain, which is common. They look at the MRI and the x-ray and they go, oh yeah, you got grade 3 medial compartment OA with some bone marrow edema, so that must be causing your pain. They do intra-articular injection. They maybe get a little bit better, 10% better, but it's not enough for a surgeon to be like, yeah, like this stuff really works. But then what we see in clinical practice and what the registries are starting to show is that when you start to actually treat the pain generators, you treat that infrapatellar branch saphenous, you treat that MCL, you treat that fat pad, and you treat the joint, that's where you're going to get much better clinical improvements. And the sad thing is there's still not a ton of research articles demonstrating that this is how it should be done. There is one study on spine that was published last year. The Saram at Lurie, he's I think from Ohio, but they did a treatment of patients with low back pain. So they took 40 patients, put them in the orthobiologic arm. They took 40 patients and just kept them in the conventional arm. So whether that was opiates, pain, other pain meds, surgery, physical therapy, radiofrequency ablations, cortisone, whatever it was, whatever was indicated for them, they got. And then the other 40 patients they did orthobiologics, and they treated all of the pain generators. Mm-hmm. Now, it's still not to what our level is, but they treated, if they thought they had facet-mediated pain because they had pain with extension, and imaging said there was or wasn't potentially facet problems, they treated the facet joints. If they had disc collapse, they treated discs, even like the worst discs where they were like 90% collapse. Yeah, they treated SI joint if there was potentially some SI joint mediated stuff. And then if there were any leg or nerve stuff, they did epidurals. So basically disc facets, SI joint, and epidurals as needed for the patient. And they saw significant improvements in so many patients that continued out 1 year. And so we're at least starting to see some people in the allopathic world recognize that, hey, there's multiple things here, and we sometimes need to treat multiple things, and we actually need to start treating pain generators and not just, oh, your imaging just shows disc collapse, okay, let's just treat that.